Well, hi everyone out there in YouTube world. Today I have another guest that's going to come on and talk about the continuation of the series, What Can You Do with Nursing? So, this is all about different nursing professions. And tonight we are super lucky to have with us Dr. Marcia Johansson, who is an acute care nurse practitioner and actively working inpatient. And she has a whole lot of alphabet soup behind her name. I think we ought to just bring her right on and talk to her. Again, if you have any questions or anything, just pop those below and we will be happy to actually answer them live while you're here. So let me go ahead and find Dr. Johansson. Where are you? There you are.
Hi.
Hi. How are
Hi
you?
there. I'm great. How are you?
I'm doing well. It's so good to see you. Thank you so much for joining us today. We have a whole lot to talk about. So I don't want to, I don't want to waste your time today. You and I can chat forever. So,
Yes, we can.
okay. Well, Dr. Johansson's here with us. She's going to talk to us about all sorts of things tonight. Marcia, tell me how you first got into how did you decide to become an acute care nurse practitioner?
So when I started nursing, everybody loves pediatrics. I thought that peds was the way to go. And
Well, some
yeah, after after about a minute taking care of those pediatric children and their parents,
you
I
lasted a
thought
whole minute.
it lasted a minute. Yeah.
Good.
I thought, you know what? I just want to take care of really sick people. So as a nurse, I always wanted the sick. I did my 2 years of med surge, and then I decided, like everybody does, and they tell you that you should. I don't know that it's the right thing to do. I don't know. I
I
think
I agree. I don't know that, that used to be and that's what they told me too in school,
right.
right? You get out of nursing school, you go to med surge, that's what you do, that's your proving grounds, then you move from there. I, I don't know that that's true anymore. I mean, maybe back in the day,
Uh huh.
but now our floors are so specialized anyway. I
Right.
mean, even med surge is a form of step down ICU.
Totally. Totally.
So,
I mean,
uh,
you do home care, and that's your med surge.
right,
Yeah.
right, for sure.
Right. So I did my med surge, and then I decided that I would like to do something with sicker patients. So I went to the
Mhm.
ICU, and in the ICU, I wanted the MI patients. I wanted the triple A's. I wanted the
Okay,
broken
so
hearts.
I'm going to interrupt you. I know what an MI is. I know what a
Oh,
triple A is, but our friends out there in
uh,
Facebook world or YouTube world or wherever they happen to be watching this might not know. So let me know. What's an MI?
so it's a myocardial infarction, and it is somebody that's had a heart attack.
Okay, all right.
And AAA is an abdominal aortic aneurysm. Okay,
Mm-hmm.
and that's the outpouching of the aorta. The wall becomes weakened, and the concern with that is that it could burst and then it could take your life.
Right. So it
So
becomes like a balloon that
correct.
lives on top of the aorta
Mhm.
down in the abdominal area, and
Correct.
if that balloon stretches too much, it can pop, and then you
Oh,
can basically hemorrhage internally, right?
correct. Correct. So those were the types of patients that I really enjoyed. Hi, Josh.
Hi, Josh.
Um, that I really enjoyed taking care of. So when I decided, and then I was working in the cath lab, and I decided, you know what, I want to go back and be a nurse practitioner. And so I looked around, and I thought acute care really fits with my taking care of sick patients. When the patients come in to the clinic, maybe you're in primary care, maybe you're family, and those are great opportunities. But
Absolutely.
I was really drawn to the sicker inpatient population. So
So
that was
are you
why I
talking
chose that.
about I'm so sorry. So there's a delay. Are you talking about like intensive care or other areas of the hospital? Where were you really thinking you wanted to be a nurse practitioner in the hospital?
So I really wanted to be. I was working in the intensive care, and I enjoyed that. So I decided that that is really where I wanted to be.
Mhm.
However, since becoming a nurse practitioner, I have worked in the ED. I have worked as a hospitalist. I have
Okay.
worked
ED.
emergency department.
Yeah. That means different things to different people.
I know. I'm sorry. I'm sorry.
So I think that one's a good one to clarify.
Working in the emergency department, I worked as a hospitalist, so I rounded on hospital patients. I have worked in the ICU as a nurse practitioner, intensive care unit. And I have also worked in the clinic setting. I've worked in vascular surgery. And I've worked in both the inpatient vascular surgery and the outpatient vascular surgery.
Okay. So what's the difference? What does an acute care nurse practitioner do in outpatient versus inpatient? For example, in the cardiovascular clinic.
So in the cardiovascular clinic, you would see patients post carotid surgery, before and after carotid surgery, before and after bypass surgery to the legs because they're having pain in the legs when they walk. Before aneurysm surgery. I mean, you see them before and after all of their surgeries that deal with, with any blood vessel in the body that is not the heart or the brain.
So how is that different from a primary care clinic?
So, well, with acute care, okay, our focus is not on just being on the inpatient, because I think a lot of people, they decide to become nurse practitioners because they don't want to work shift work, or they want to work shift work, but they don't want to work in a hospital. They want to work in a clinic. They want to work in an emergency department. So for acute care nurse practitioners, it's not where you work, it's the population of patients that you take care of. So
Okay.
you could work in a clinic, you could work in a neurosurgery clinic, you could work in a neurology clinic. I chose vascular. You can work in a pulmonology clinic, or any kind of acute problem in either the inpatient or the outpatient. Does that make sense?
That makes perfect sense.
Okay.
And while you're explaining, and I know you know, I'm also an acute care nurse practitioner, and I know you know that. And I think that our most of our listeners or our listeners, viewers,
Both.
watchers, both. I don't
Listening, listening and viewing.
know. Both of the people who know about the academic nurse and know my story know that I am an acute care nurse practitioner as well. So, but I want to ask about a nuance that I get asked all the time in the academic setting, and that is, what is the difference between an acute care nurse practitioner and adult geron an adult gerontological, oh, it's a mouthful, nurse practitioner? What's the difference?
So the difference is that the acute, it's the acuity of the patients. So the primary care nurse practitioner can care for. They can work in the inpatient, but if the patient goes to the ICU, they cannot care for that patient throughout their whole spectrum of care in the hospital. A lot of the hospitals are, if you are adult geron primary care, you cannot be in a hospital,
Right.
because you need to have that acute. You're just taking care of chronic disease states that patients have. You are
Disease
not
and
taking care.
wellness, right? But
Right.
I specifically mean, like, what is the difference between an old school ACNP and a new AGACNP? What's the difference?
The Agacnp has received training in the adult and older adult population, where the acute care, the ACNP, okay, and it's adult gerontology acute care nurse practitioner, or the acute care nurse practitioner.
Mm-hmm.
The adult gerontology has had special training in managing the care of the elderly.
Right. So interestingly, when I went to school 1,000 years ago, we had that training. They just, for whatever reason, didn't combine those initials until a certain point. And of course, we all know the backstory. I'm not going to bore everybody with that here. But, once there was a consensus model, a LACE model happened, and the ANA came together, the AACN, all the initials, insert initials here, decided that they would bring together the types of nurse practitioners and standardize that education. Then the adult geron acute care NP was born. However, the acute care NP still exists. It's just grandfathered in. and no one can test for it anymore. So if you are certified, keep your certification.
Totally. If you lose your
Because if you lose
certification,
it,
yeah.
there's no testing for it.
And they send you letters. They're like, do not let this lapse, or you will have to go back to school and learn all of this over again.
Absolutely.
And
And
sit
who
for the
wants
certification, because it's a totally different certification exam.
it is. It is. It's very interesting too. I've actually taken the practice one. So having said that, what did you have to do as far as education? What does that look like?
Well, I had to come in and had to have a bachelor's in nursing.
Mm-hmm.
And then I was able to, I enrolled in the master's program. And it was 1 year, it was 3 semesters after I started. I had some prerequisites to take, but it was 3 years or 3 semesters after I started, because I had to do 500 clinical hours over and above the coursework.
Okay. All right. So I've heard that that's changing. What do you know about that?
I have heard it's changing. I've heard that the requirement is going to go up to 750. I'm not quite sure when that's going to occur, because I know that it just recently came out, and I know that programs are looking at it.
Right, right. So for those of you who may not know, the programs are about to change to 750 clinical hours for master's level clinicals above the didactic time requirements. So what does that mean? Well, that means that there are clinical hours that you have to complete. And for those persons out there who may want to say something negative about it only being 500 or 750 hours, when we're coming into this, we're already typically prepared with a bachelor's of science in nursing and have been practicing for a long time. In my case, several years. I know in your case, several years before going on to get a graduate degree. So all of that counts. And we'll just leave it at that. Having said that, now I also heard, and tell me what you think about this, that there are different pathways to become a nurse practitioner. So in acute care, can you have a master's or do you have to have a doctorate or a DNP? We both have DNPs, but do you have to have that?
Many of the programs are going to that, because that is the terminal degree, and that puts you at a different level.
But is it necessary to practice? Do you have to have a doctorate?
No, you do not have to have a doctorate to practice. You can have a master's in nursing. I don't know that anybody's going to be grandfathered in. If you get a master's and then they suddenly decide that you need a DNP. But I mean, we've been saying that for a long time about the associates versus the bachelor prepared nurse. And, we still have those programs that are out there. So I don't think that states are going to unify and make this happen in the near future.
Right. So what I think is going to happen, and I actually did another video on this. If you're interested, if you're out there watching and you're interested, I did talk about this in a different video. I'll look for it in just a second. I'll pull it up and pop it down in the contents.
Questions.
And the contents, I'll put them in the contents because that's where they go. Now I'll put them in the comments for you. So if you want to watch that, but so the question is, do you have to have a DNP to be a nurse practitioner? And right now the answer to that is no.
Correct.
Most programs around the country still have, or not most, but some programs around the country still have a master's exit or a master's portion. Now, many programs, and I happen to work at a program that only has a DNP program, only have a DNP program. So that is just preference on the university or the college, and it is not part of what the licensing bodies right now are considering. Right now, master's is what you have to have a certification, and then there might be some nuances that are state-based, but other than that, that's really all we need to talk about as far as that's concerned. So for your education, you did get a master's, and you spent what, 3 years, 4 years?
Getting a master's?
Yeah.
I spent 2 years getting a master's.
Oh, so you went full time.
Yes.
Yeah. I did too, but it's so uncommon to hear anymore.
I know.
Because I had my bachelor's and then I had the 2 years of 2 years for my master's, but it was a lot, a lot of hours.
It
I
was a
don't even
lot of
know if that's
hours.
offered anymore the way that I did it or the way that you did it. It's just
Right.
so uncommon.
Yep. Yep.
And then after your master's, you spent some time practicing
I did.
and
I spent many, many years, 12, I go to school every 12 years.
oh,
Um,
you're on that cycle. Okay.
yeah, I'm a 12-year person. So I do it for 12 years and then I decide, oh, I think I'm bored right now. I think I need something different.
Right.
So then I went back because I became interested in education and
Sure.
in teaching. And when I originally looked at the program and I looked at the DNP program, I didn't feel that it was going to enhance my clinical practice.
Mhm.
I wasn't going to be in a different position or in a different, like it didn't work for my goals at that time. Now
Sure.
it does because I wanted to teach, and I think that DNP prepared nurse practitioners have a lot to offer. They have a lot to offer hospitals. They have a lot to offer services, service lines, to be more of a leader in, like, say, Heart and Vascular Institute, or some of those services that are higher up in a hospital, where you could probably have more autonomy and help to provide a little guidance.
Right. And so some positions just require a terminal degree, which is what
Correct.
a DNP is. We have PhD colleagues too. We have EDD colleagues. There are many ways to, that's a terrible, I almost said to skin a cat, but that's the Southern coming out. I mean, that's a terrible saying. I'm going to stop saying that. But there are many ways to meet the goal, right?
Right.
Um, so DNP is definitely one option. And with more programs going BS into DNP, that does help. And I want to clarify one thing too. Just earning a DNP does not necessarily prepare a nurse to teach. There has to be typically
Correct.
more education type courses, which you and I both have taken, and other things. But you are still working clinically, is that correct?
Correct. I decided, I have always liked to work clinically. It gives me, when I was teaching, it gave me more of an idea of what's going on in clinical practice, that I could help my students. So
Right.
like, even if it's one day a week, to
Hmm.
do clinical practice, so that I can be aware of the changes that are coming down with the state, with the hospitals,
Hmm.
what's coming down, and what are some of the challenges that we have. And it also gave me really good examples for the students. Like, I had this patient that came in, blah blah blah, they had this and that, and the students are like, oh my god.
Yeah.
um,
I still call back to some of those clinical experiences and say, you don't think you're going to see this, but you will.
oh, you do.
Like,
Yeah.
this is what happens. So
Yep.
yeah, it's really important to be able to call on those experiences and to stay relevant. So
Totally.
I'm going to pop you up on the screen and let you just walk us through a day. What's the typical day like as an acute care NP? What do you do?
I personally, okay, I work in the vascular clinic right now, and I come in the morning. It depends on if I have clinic or not. On the clinic days, I come in. I look through our Epic messages, looking for, are there any issues. I look at what the patient list is for the day. Who are we going to see? Are there going to be? Is there anything outstanding that I'm going to need to do for them? And then answer the message. Like, I may put in some comments into the Epic system, of a patient issue that I know of, or something like that. And then I just go through the day. I see all the patients that come in. I present them all to the physician. And I work with vascular surgeons, so I present them to the physician. And then I educate the patients. I talk to them, how are things going? What are some of the nuances that are going on in their lives, just to figure out um, how we can support the patients from the vascular surgery side. And then we see the patients, and then, a major portion of the day is writing notes. Usually we're done by 5. My notes are usually done by about 6:30. It usually takes a little while to write the notes. And then that is a full clinic day. Normally we only see clinic patients half the day. And so the morning is spent calling patients, following up on studies, putting prescriptions in, stuff like that.
Well, thanks for telling us that. I was looking up this video that I thought that people could watch to talk that discusses what we were just talking about. So I'll pop that up on the screen in just a minute, just so that people can see what it looks like, so they can go over to it. But I did put the links down in the comments. So if you want to go over to the link, you can see that. What's your favorite thing about being a nurse practitioner?
I love the diversity. Right now I'm in the clinic, but I also work in the hospital. I love the diversity. There are no 2 days that are exactly the same.
That's for
And
sure.
I love the fact that I can provide the patients with the information to improve their health, to take care of themselves in the acute phase of their illness. And I just like the diversity. I'm easily bored. And so it just provides me with that opportunity to do different things.
What advice would you have to give to someone who's considering being an NP?
Being an acute care nurse practitioner.
Yeah, acute care first, and then just a nurse practitioner in general.
Right. I think it is one of the most rewarding jobs that I've ever had. The fact that you can come in and really make a difference in a person's life, especially, like this past 2 years with COVID, holding somebody's hand while they passed, trying to provide the care that they needed and keep yourself and your family safe. I mean, those are really important things. But I think that being a nurse practitioner, one of the biggest advices that I can give is remembering that your first nurse practitioner job is not your forever nurse practitioner job. And so, it's learning from your mistakes. It is finding something that you're passionate about and then being able to do it. And I think that is the most, one of the biggest the things that drew me to be an acute care nurse practitioner is because I love taking care of patients, and I love them when they were at their sickest. So, remembering that your first job is not your forever job,
Right.
and finding something that you love to do. I love that saying that if you find a job, something that you love to do, if you find a job that you love to do, you'll never work a day in your life.
Right.
I feel that way sometimes, especially with being an acute care nurse practitioner.
Yeah, sometimes I feel that way. Other days, not so much.
Yeah, I know.
Other days, it's definitely a job, but that's okay. I mean, that's okay. I mean, I think that's the way that any kind of career would go, right?
Right. And, I think that, one of the key things is that as an acute care nurse practitioner, you're in a hospital setting. Being in a hospital setting,
Usually.
yeah, you provide a lot of education and support to the nurses that are there. And I think that is really important. They get no support. They don't get, like the patients are demanding, the physicians can be demanding, but you as the nurse practitioner are there. And I feel that, on the floors that I am on most of the time, I really can give them some support, and I have a lot of camaraderie with those nurses, and I really enjoy that.
Well, that's great. And I'm so glad to hear that, because after all, nurse is foundational in
Totally.
title,
Yeah.
nurse practitioner, because we are based in nursing, right? So it's important to remember that and not lose that, which is why I'm really happy to hear you say that. Now, this is something that people always ask, and you can be as specific or as general as you'd like, but can you tell me about salary opportunities for nurse practitioners, especially acute care NPs?
So I'm going to tell you, with a lot of the students that I've worked with and with myself. So when I was going back to school, I was a transplant coordinator. I got call pay, I got, night different, you have all those differentials. And so when I became a nurse practitioner, I was offered $1,000 more than I made as an ICU nurse, as a transplant nurse. And
Just
for a lot of people, they think that they're going to make, six figures right off. Okay.
mhm.
And it depends on where you're working, and it depends on the need. Our local areas, they offer between 100 to $105,000, 105,000. Yeah, that's right. $105,000 a year. Okay. Is that right? Yeah.
Well, that depends. That's usually base, but there's
That's
a
the base.
larger
Okay.
package.
Correct.
And
And if you're working in a hospital, there's the differential. There's, now
mhm,
they're having, they have ladders for nurse practitioners. Like
right.
they have ladders for nurses, they now have ladders for nurse practitioners. So the base pay is usually, because remember,
And
you
that's
are
starting pay. That's starting pay,
correct.
not
You are starting,
experience.
and you have no experience as a nurse practitioner. You have tons of
Mhm,
experience as a nurse, but no experience as a nurse practitioner. So um, they are looking to pay you as a starting nurse practitioner, and it's between 100 and 105. And it all depends on where you are. Now, I had a student who called me. He said, "You know what, Dr. Johansson, they're going to offer me $150,000 a year."
mhm,
And I said, "What is the job?" Okay.
right,
And it was, like on call every day, all night, no, they got the standard vacation, but they didn't, the requirements were untenable,
right,
essentially.
right.
You were being a first year resident.
Sure, and that's a really good point. There is so a couple of things with that starting salary that is very regional dependent. It is very different for other regions. We're in Florida, um, but there are certain regions in the country where it's much higher, and I actually go over that in that video too. But there also are places in the country where it might even be lower. And again, that starting salary, that is not experienced salary or with additional certifications or add-ons or other things. So nurse practitioners with, a few years under their belt probably can expect to add significantly to that figure, based on, and again, depending on where you are and the acuity of the situation. Do you find that accurate?
Yes, and what is the need? If you go to an area like, I don't know, a small rural town where they have 20 nurse practitioners, okay, they they're not going to offer you a salary, that's like a big city salary, okay.
Unless you're
Where,
the only game in town.
correct,
If
correct.
you're the only one, and that again speaks to need. So you really just need to research the area, but also I find, and you kind of alluded to it when you were talking about your student who was offered this great starting salary, but maybe the responsibilities and the expectations of the position would have been such that he sold his soul,
Totally.
or sold his life basically for a few thousand extra dollars. So, and I don't want to make light of that. I mean, every penny counts in my house. I can tell you
Right.
that. Um, but you also have to think about quality of life. We talk about that for our patients all the time, but as providers, we also have a quality of life. And if making a little extra salary means that you have no downtime, no evenings, no weekends, you're on call all the time,
No
uh,
time with your family.
no family time is not a thing, and you're expected to be at the beck and call of someone or some entity all the time, those few $1,000s really might not be worth it to you.
Agreed. Agreed. So, think about those things. Negotiate. If you feel that you are worth more, then write it down. What makes you worth more money?
That's a
What
good
can you
point.
what can you bring to the service that, that Dr. Taylor down the street can't bring? Okay.
Right.
What is it that you can bring that somebody, that I hire right out of school can't bring?
What makes
So,
you stand out? Like,
correct.
what experiences make you stand out? And that's one thing that I try to reiterate with students and when I've been in positions to hire people. What makes you stand out? Why hire you over someone else? And I think that those are the things that students really need to discuss when
Right.
they are in an interview situation, or not just students, but any nurse practitioner or any nurse, really
Right.
anyone.
Right. Right.
why why hire you? You know?
Right. Right.
So I think that's super important.
And if there's something that you want to do, like if they say you wanted to do, I don't know, vascular, you should join that society, see if it's something that you want to do. Maybe even do a fellowship in that area or do a shadowing, to make sure that that is what you want to do, moving forward. So you have a lot of opportunities in acute care. It's just honing it in and deciding exactly what you want to do.
What is something that you wish you had known before you decided to be an acute care NP?
um,
Uh-oh, did I stump you?
I know you did.
I've
I'm
never
like,
seen
what?
you speechless
I
before. Is
know.
that really a thing?
I'm sorry. I'm like, I don't know. I think that I went into it with my eyes wide open. I knew what the job was going to demand, and so I think um, there was little that I didn't expect. Um, it was just, what was I going to do? People like to plan their future. Okay. And
Right.
I went into school without having, I mean, I had a nurse job, but I didn't have a nurse practitioner job. And when
Mhm.
I got out, everyone's like, oh, I'm going to go and work for this person and I'm going to work for them. And I was like, I don't have a job, like, I mean, I have a job as a nurse, but I don't have a nurse practitioner job. And so when I was done, I looked at my family situation. I have twin boys, and, like, I looked at that, where were they at school? What, like, was I going to be able to be there for them as well as work? And so I looked at a job that I could kind of make my hours. Okay.
Sure.
And be there for the patients, but also be able to, if I needed to leave in an emergency, I wasn't leaving anybody hanging. And so I think knowing that you can have, as a nurse practitioner, you can have quality of life is really important.
Right. And those are the jobs you have to really, really seek out if that's
Right.
important to you.
Correct.
And
Correct.
if it's not important to you, I would really recommend that you make it important to you, because if you don't consider your quality of life, that is the number one reason that nurses, nurse practitioners, really a lot of people in healthcare burn out,
Right. And I
because that
think that,
balance is gone and you don't, and if you're not given the resources, if you're stretched too thin, those
right.
sorts of things can lead to burnout really quickly. So think about that quality of life.
Right. And I think it's important to know that, as an acute care nurse practitioner, some people are like, I want to work Monday through Friday, no weekends, no holidays. So I think I'm going to go and be a family nurse practitioner or primary care.
Mhm.
Okay. We, as acute care nurse practitioners, can work in a clinic. We can work in a hospital. I personally like working the 12 hours and then having 4 days off. Okay.
Right.
I like that, like having 4 days during the week. I can go to the store when, not every single person is there with their 5 kids, touching everything and, being in the aisles.
Uh-oh.
I know.
Back
I
to
know.
peds.
I know. Back to peds.
It's usually not the kids that bother me in the store. It's usually like the adult that won't get out of your way. Or I went to the store today and there's this person who's like, I swear, was stalking me with her buggy. And everywhere I pulled in, she would like be coming the opposite direction and then put her buggy on the wrong side of the aisle and block me. I'm like, hello.
They need to have lanes. They need to have,
We're in America. We have lanes. You travel on the right side of the aisle. You don't park against the grain. What are you doing?
well,
Anyway,
sometimes you have to do that. If you're going for the mayonnaise and it's on the bottom shelf, on that aisle, it's
no,
hard
I
to walk.
like there are emergencies for sure. And being out of the correct mayonnaise could be one of them. I'm not sure.
I don't
Uh,
think it is. I
for
don't
me,
think.
it wouldn't be mayonnaise. I would be over on a different aisle. But anyway, just saying that I understand what you mean. Like, it's good to be able to have that time through the week. I've always kind of felt the same way. I think you and I are a lot of like in these areas, which is why we're
Right.
kind of drawn to the same
Hmm.
types of things. And really, a lot of our colleagues that we've worked with, you and I have both worked with together and separately, exhibit a lot of the same types of behaviors and preferences.
Correct. And when my kids were little, I worked Monday through Friday, no weekends, no holidays. But, as they got older, I want the time off. I wanted to be able to, they didn't need me all the time. And so it was just easier to work the 12-hour shifts and call it good.
Yeah, I've pretty much done 12s. I mean, I use inpatient, ER, ICU, whatever. But even so, I always did 12s, even when the kids were little, just because I found it. I don't know. I liked having a day off during the week. I liked being able to have the
Mhm.
flexibility to change shifts if I had. I always tried to make sure I wasn't a one person show.
Right.
So, like the only NP working for a service or the only NP working in a certain area. That way, if I needed to swap because my kid had something at school or, God forbid, I had to go do self care and have a doctor's appointment.
What is that?
What is that?
What is
What
that?
is that? So, doing self care or kid activities or going to the bank or dry cleaning, whatever it is, the things that we do. I like to be able to do that during the week. So I'm with you there. Like a
Yeah.
12-hour shift is where it's at for me, but
Mhm.
everyone's different. And
Everyone's
I completely get those 8 to 5 folks. And I can tell you as a single parent, the 8 to 5 is easier because I've been a single parent too, and that's much easier. The 8 to 5 Monday through Friday, at
right.
least it was for me. It was easier because there was typically childcare available and those sorts of things. But you're right; it's all about finding out what works for you and your family, and and
And the
every
nice
family looks different. Every situation's different.
and the nice thing is you're not stuck in that. Okay. You can do so many different things, just like in nursing. You can work on med surg, you can work in urology, you can work in the OR, you can work in the ICU, you can work in the PACU. And that's the same for nurse practitioners. Is you can work wherever you want. Okay. You're
Within
not
your scope of practice, right?
correct. I'm sorry, I misspoke. Wherever you want. No, you can work within your scope of practice, but you can work in any setting. You are not limited just to the four walls of a hospital.
Right, right. As an acute care NP.
Correct.
Right. So that's something that I want to ask you about because in education, I hear this quite a bit. And sometimes in the clinical setting, I'll hear something like become one certain kind of nurse practitioner over another because you're more marketable and because you can work in any setting. And I'll usually say, that's not correct. Let's talk
Correct.
about it's super important to understand scope of practice, where you can and can't practice, and
Correct.
the populations, and it's population driven, as you mentioned earlier. Is population then acuity, correct? So
Correct.
those are the two things that you have to understand: population, setting, acuity. Those are the things that really define your scope of practice. And we're not going to go into that discussion because we could be here all night.
We
But
could.
yeah, we could. I mean, if you have questions about it, please feel free
Right.
to email us or drop it in here. If you're live with us and want to ask a question, you can put it down on screen. We will be happy to answer it. You just put it on screen. You can't put it on screen, but you can add a comment below, and I can put it on screen um, if I remember how to press the right button. So that's always fun. Learning all these streaming things, it's all fun. Anyway, tell me, Marcia, what do you think? What advice do you have to give to someone? And I know you kind of touched on this earlier, but what advice do you have to give to students in today's climate with the things that we're facing, like the nursing shortage, the conditions, working conditions in hospitals, resources being stretched? Things are completely different in
Things are
today's environment than they were perhaps when you and I graduated, and it's been a minute.
maybe.
Maybe like 5 minutes or
Yeah, like
15 or
5 minutes. Yeah.
17
It was
minutes.
yesterday.
It
Yeah.
was yesterday. It was last night. Sorry,
Yeah.
I just graduated. My cap's over there. Um, So really, so tell me what advice would you have for a student that's considering it today?
So I think that you have to decide what it is that has attracted you to become a nurse practitioner. Is
Hmm.
it dealing with the hypertension management and weight loss and diabetic management that you would have in a primary care or family setting? Or is it dealing with, a chest pain patient that comes in through the ED? Maybe they've done some of their blood work and they've ruled out a heart attack, but they still need to be in the hospital. You need to decide what type of patients that you really like to care for and how, it does get monotonous. I'm not going to lie to you. Taking care of, so like, if I think that if I had to go to the clinic and see patients with hypertension all day long, here's the guidelines. You have to lose weight, you have to do this, you have to do that, let's change your blood pressure medicine. um, it would be challenging, but I would lose interest fast. That is why I like the acute care setting, is because yes, it's challenging, but I don't lose interest because there's so much diversity that I can see. I go anywhere from carotid surgery to leg bypass to aneurysm surgery, and not just aneurysms in the lower abdomen, but aneurysms in the chest. Does it come out of the aorta? If it comes out of the aorta, it goes to cardiac surgery. If it is in the descending aorta, where the part that comes down, it comes to vascular surgery. So there's a lot of different variations. Are you wanting to do vein care? There's a whole myriad of different
Herod.
yeah, diseases that are venous in nature. Okay,
Sure.
a blood clot, varicose veins. There's this thing called May-Thurner syndromes, where the artery is on top of the vein and it causes some external compression. So there's
Right.
just a lot of different, really unique opportunities
Hmm.
that are out there. You just have to find what you're most passionate about.
Right. So
So
you can
if there's if there's
specialize.
correct. If there's advice I could give, it is finding something that you love, and then going for it.
Well, Weezer agrees.
Hi, Weezer.
She has been growling and barking kind of this whole time because she hears her Aunt Marcia.
Hello.
So let's put her down. Um, okay, well that's awesome. I really appreciate that. Tell me something funny. What's like a funny thing that you have encountered in nursing or as a nurse practitioner? What's something really funny? That's of course HIPAA compliant.
Um, really funny. Um, I mean, I think that patients are extremely, um, they love a nurse practitioner that speaks at their level. Okay, I mean,
Right.
I think that one of the funny situations was we were trying to teach a patient's family how to do a dressing. Okay, they were going to get home care, but how to do the dressing, and the wife was like, "Oh my!" Like, she was trying to do it with her eyes shut, and I was like, "No, no, no." Your eyes have to be open for this. This is not something that you can do blindly to pack into somebody's wound. So
That's
that,
like me doing trach care,
yeah,
eyes closed.
yeah, I know. But
That's my thing. Everybody has their thing, right? Mine
yeah,
is sputum. I can't do sputum. No,
a lot of people don't like that. A lot of people don't like any kind of pus,
that doesn't bother me.
wound pus.
That didn't bother me at all. I can
Yeah,
take care of that all day.
yeah.
Um,
I don't like
but
the smell of it.
meh, I don't. That
Yeah,
didn't really bother me. It's for me though. It's the ugh,
yeah, the
can't.
trach. Yeah.
Nope.
So yeah, it's the patient's family trying to, she's like, I'm not a nurse. I don't even think I could ever be a nurse, but I'm trying to do this for my husband. So, I was like, no, 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 you can't. You have to look, you have to inspect it, you have to kind of be there. But that was interesting.
Yeah, yeah, for sure. Well, there's always those moments, right?
Always.
So, Marcia, if a student was thinking about this, and are you open to being contacted to like?
I totally am. I would love, I think I've given you my contact information. You can email me. You can, we can chat on the phone. But I think it's important that if you have questions, that you come to a reliable source, not somebody that doesn't know the field and know what's going on. And I would be happy to, Dr. Taylor's great about that. We can put you in the hands of somebody that's very competent and they can give you good advice.
Right. So this is Dr. Johansson Marcia's contact information. Of course, this is mine. And the last thing that I wanted to show you all, let's go back and let me see if I can do this. So give me just a second working the technology here. You know how fun that is. Let's see here. I gotta share screen. Okay. Share window. Chrome tab. Sorry, got to go through the whole thing. Okay. So can you see this?
Yes.
Okay. So this is the YouTube site, the YouTube channel for the academic nurse. And the video that I was talking about is this one, MSN or DNP for nurse practitioners. So that's the one that you would want to watch that would answer those questions that we had earlier and we were talking about. There are others on here if you're interested, but that is that one, and it is right up front. So it should be close and easy for you to find. All right, so let's see here if I can remove that now. Look at that.
Woo!
Look at that. Working the technology like a boss.
God.
Sorry, we get punchy this late. Okay, love. Well, thank you so much for joining me today, Dr. Johansson.
Thank you for the invitation.
You've been super insightful. Again, if anybody wants to contact her, her information's there. I'll pop mine on again in a minute. But we are just so thrilled that you could come today and talk to us all about what it means to be an acute care NP. So thank you.
Thank you. Thank you.
All right, Brendan. All right, all you folks out there in YouTube land, have a great week, and we'll catch you next week on the next episode. I think we're going to have a neonatal nurse practitioner. We'll see. All right. Take care, y'all.
Take care. Bye, everybody.